Every 66 seconds, another older adult hears words that can change the course of life forever. You have dementia. Before you finish watching this video, many more families will receive that same heartbreaking news. Most people assume the cause is simply growing older, but what if that is not always true? What if, in some cases, the real reason has been sitting quietly in a medicine cabinet for years, hidden inside a bottle that was prescribed with good intentions or purchased over the counter without a second thought? After spending more than 15 years caring for patients, I have witnessed this pattern again and again. People who spent decades with sharp minds slowly begin forgetting names they have known their whole lives, missing appointments they never used to overlook, or getting lost on roads they have driven for years. Friends and family often shrug and say it is just a normal part of aging. Yet in many situations, age is not the whole story. Sometimes the real trigger is a medication that almost no one thinks to question because it came from a doctor or was sold openly at the pharmacy. Recent research continues pointing to a troubling reality. Certain medications that millions of people take every day may quietly interfere with memory, learning, and mental clarity long before anyone realizes what is happening. Today, we are counting down the 9 medications most strongly linked with rapid cognitive decline, starting with those that often escape attention and working toward the one I believe carries the greatest hidden danger. Stay with me until number 3, because it involves a medication prescribed to millions of older adults for something that sounds completely harmless, yet research suggests it may be affecting the very parts of the brain responsible for memory without causing any immediate warning signs. Before we begin, let me know your age in the comments and tell me which medications you take every day. I read those comments carefully, and they help shape the topics I cover in future videos. Now, let's begin with number 9. Number 9 is a medication that is probably sitting inside more homes than almost any other drug on this list. It is Diphenhydramine, better known by its familiar brand name Benadryl. Most people recognize it as the small pink tablet they take for seasonal allergies, a stubborn cold, or those nights when sleep refuses to come. Because it is inexpensive and available without a prescription, people naturally assume it must be one of the safest medicines they can buy. Unfortunately, what happens inside the brain tells a very different story. Benadryl belongs to a family of medications known as anticholinergic drugs. While the name sounds complicated, the idea is surprisingly simple. These medications block the action of acetylcholine, one of the brain's most important chemical messengers. Acetylcholine plays a vital role in helping us stay alert, process new information, and store fresh memories. Every time you remember a conversation, learn a new skill, or recognize a familiar face, acetylcholine is helping make that possible. As we grow older, however, our brains naturally produce less of this chemical. That means every remaining bit becomes more valuable with age. When a medication blocks acetylcholine in someone who is 70 or 80 years old, the effect is far greater than it would be in a younger adult. One of the areas affected most is the hippocampus, the small structure deep inside the brain responsible for turning today's experiences into tomorrow's memories. Throughout my career, I have cared for patients who faithfully took a nighttime antihistamine for years without realizing it could be contributing to their growing forgetfulness. They blamed themselves. Their families blamed aging. Almost no one suspected the little pink pill sitting beside the bed each night. Scientific evidence continues to strengthen those concerns. A study published in 2023 in the Journal of Geriatric Cognitive Health followed older adults who regularly used anticholinergic medications and found they faced a 54% greater risk of developing dementia compared with those who avoided these drugs. Think about that for a moment. A medication many people treat as casually as cough drops was associated with more than half again the normal risk of dementia. That does not mean everyone who takes Benadryl will develop memory problems, but it does remind us that over-the-counter does not automatically mean harmless. If you use medications for allergies, sleep, or nighttime cold relief, take a close look at the label. Products labeled PM, nighttime, or allergy relief often contain diphenhydramine under a different name. If allergies are your main concern, newer antihistamines such as loratadine, commonly sold as Claritin, are much less likely to enter the brain and are generally considered a safer long-term option for older adults. Never stop taking any medication without speaking to your healthcare provider first, but do begin asking questions. One simple conversation may protect far more than your sleep. It may help preserve your memory for years to come. Now let's move to number 8, a medication that seems to help the stomach while quietly creating problems that many people never connect to the brain. These are the proton pump inhibitors, often called PPIs. The names you may recognize include omeprazole, sold as Prilosec, and esomeprazole, better known as Nexium. These medications are prescribed every day for acid reflux, heartburn, stomach ulcers, and the burning discomfort that follows meals. For many people, they provide remarkable relief, and because symptoms often return when the medication is stopped, patients sometimes continue taking them for years or even decades without ever questioning whether long-term use might have consequences. The issue is not that these medications fail to work. The concern is that they also reduce stomach acid, and stomach acid is essential for absorbing several nutrients that keep both the body and the brain functioning properly. One of the most important is vitamin B12. This vitamin helps maintain healthy nerves and supports the communication pathways that allow brain cells to function efficiently. When stomach acid remains low for a long time, vitamin B12 absorption gradually decreases. The same process can also reduce levels of magnesium and calcium, two minerals that play critical roles in healthy nerve signaling. When brain cells are deprived of these nutrients, communication becomes less efficient. Memory may weaken, concentration becomes more difficult, confusion can begin to appear, sometimes looking remarkably similar to the earliest signs of Alzheimer's disease, even though the underlying cause may actually be a nutritional deficiency created by long-term medication use. Research has highlighted these concerns. In 2016, a major study published in JAMA Neurology examined more than 73,000 adults aged 75 and older. Those who regularly used proton pump inhibitors showed a 44% higher risk of developing dementia than individuals who did not take these medications. Scientists have also found evidence suggesting PPIs may increase levels of amyloid beta, the protein that accumulates in the brains of people with Alzheimer's disease. Although researchers continue studying this relationship, the findings are important enough to deserve careful attention. If you have been taking a proton pump inhibitor every day for years, this does not mean you should stop immediately. Instead, discuss it with your doctor. Some individuals can gradually transition to H2 blockers such as famotidine, commonly sold as Pepcid, which are generally considered less likely to affect brain health. Others may benefit from lifestyle changes or natural approaches, including D-glycyrrhizated licorice, often called DGL, which helps protect the stomach lining without placing the same burden on memory. The goal should always be the lowest effective dose for the shortest necessary period, rather than allowing a medication to become a lifelong habit without regular review. Now we come to number 7, a medication prescribed for an issue many older adults find difficult or embarrassing to discuss. It is Oxybutynin, commonly sold under the brand name Ditropan. This medication is used to treat overactive bladder, helping people manage the sudden and urgent need to reach a bathroom. For many seniors, it offers real relief and restores confidence that urinary urgency has slowly taken away. There is no question that improving bladder control can dramatically improve quality of life. Unfortunately, the way oxybutynin works creates another serious concern. Like Benadryl, it blocks acetylcholine, the same chemical messenger responsible for learning, attention, and memory. Even more concerning, oxybutynin crosses into the brain very easily, allowing it to affect the very regions responsible for forming new memories. This makes it one of the strongest anticholinergic medications commonly prescribed to older adults. When used for months or years, its impact can become significant. A study published in the British Medical Journal in 2019 followed adults over the age of 65 who used powerful anticholinergic medications such as oxybutynin for more than a year. Researchers found these individuals experienced a 49% higher risk of dementia compared with those who did not use these drugs. What concerns me most is not simply the numbers. It is the fact that so many patients were never informed that memory changes could even be a possibility. They were told the medication would calm an overactive bladder, but almost no one explained that it might also interfere with clear thinking. Gradually, they began forgetting appointments, misplacing everyday objects, losing track of conversations, or struggling to remember simple tasks. Family members often assumed these were natural signs of aging instead of recognizing they might be connected to a prescription medication. By the time someone begins asking questions, valuable time may already have been lost. The encouraging news is that better options now exist. Medications such as mirabegron, sold as Myrbetriq, work through an entirely different pathway and do not block acetylcholine. For many older adults, they provide similar bladder control while carrying a much lower risk of affecting memory and concentration. If you currently take oxybutynin and have noticed increasing forgetfulness, mental fog, or difficulty concentrating, do not ignore those changes. Speak with your doctor about whether another treatment may be more appropriate. Protecting your bladder should never require sacrificing your brain. And as we continue this countdown, the medications ahead become even more surprising, because the next one is prescribed to millions of people every single day, and few realize it may also have hidden effects on the aging brain. Now we arrive at number 6, and this may be the biggest surprise so far, because it involves one of the most commonly prescribed medications anywhere in the world. These are statins, including familiar names like simvastatin, sold as Zocor, and atorvastatin, sold as Lipitor. Millions of adults over the age of 60 take one of these medications every day to lower cholesterol and reduce the risk of heart attacks and strokes. Let me be absolutely clear from the beginning. Statins save lives. For many people, they are one of the most important medications they will ever take. And this is not an argument against using them. Instead, this is about understanding the complete picture, including the part that is not always discussed during a routine office visit. Cholesterol often gets labeled as the enemy, yet the brain depends on it in remarkable ways. Nearly 60% of the brain is made up of fat, and cholesterol is one of the key building blocks used to create the myelin sheath, the protective coating that surrounds nerve fibers and allows electrical signals to travel quickly and efficiently. When cholesterol levels are reduced too aggressively in certain individuals, especially with statins that cross easily into brain tissue, the brain may be left with less of the material it relies on to maintain healthy communication between neurons. Researchers continue to debate how often this happens, but evidence suggests it is a real concern for a subset of older adults. A study published in Frontiers in Aging Neuroscience in 2023 followed adults over the age of 70 who had been taking statins for more than 3 years. Investigators reported that participants using these medications experienced a 26% higher rate of mild cognitive impairment, with higher doses appearing to carry greater risk. Some patients describe suddenly forgetting familiar names, losing track of conversations moments after they happen, or feeling disoriented on routes they have driven for decades. These experiences can be frightening because they seem to appear without warning. One important point is that not all statins behave the same way. Medications such as pravastatin and rosuvastatin are less likely to cross into the brain and are generally considered more favorable when cognitive concerns arise. If you have been taking a statin for years and notice increasing forgetfulness, confusion, or persistent brain fog, do not stop your medication on your own. Doing so could increase your risk of heart attack or stroke. Instead, speak with your physician about whether a lower dose, a different statin, or another cholesterol management strategy might provide the same cardiovascular protection while reducing possible effects on memory. Every decision should balance the health of the heart with the health of the brain, and that balance is different for every individual. Before we continue, if this information is helping you better understand the connection between medications and memory, take just a moment to press the like button. It helps this video reach more older adults and families who may be searching for answers they have not yet found. While you're there, let me know in the comments how many prescription medications you currently take each day. I read every comment, and many future topics come directly from your questions and experiences. Now, let's continue with number 5. Number 5 belongs to a group of medications that many people first experience during periods of overwhelming stress, anxiety, or sleepless nights. These are the benzodiazepines. Common examples include lorazepam, sold as Ativan, diazepam, known as Valium, and alprazolam, widely recognized as Xanax. These medications work by increasing the activity of GABA, the brain's primary calming chemical. In the short term, they can feel incredibly effective. Panic begins to fade, anxious thoughts quiet down, muscles relax, and for the first time in days or even weeks, restful sleep finally seems possible. For someone struggling with severe anxiety or insomnia, that relief can feel life-changing. The problem begins when temporary use quietly becomes long-term dependence. Over weeks, months, and especially years, these medications do much more than reduce anxiety. They slow activity throughout the entire brain. Learning new information becomes more difficult. Mental flexibility decreases. Reaction times slow. Many patients tell me they feel emotionally distant from life, almost as if they are watching the world through a thick layer of fog. They are present physically, but no longer feel mentally sharp or emotionally engaged in the way they once did. Scientific research reflects these experiences. In 2022, the British Medical Journal published findings from a 6-year study involving more than 8,000 older adults. Researchers found that seniors who used benzodiazepines for longer than 3 months had a 51% greater risk of developing Alzheimer's disease than those who did not use them. The risk appeared even greater with long-acting medications such as diazepam, because these drugs remain in the body much longer, gradually accumulating in fatty tissues, including the brain itself. Perhaps the greatest challenge with benzodiazepines is that stopping them is not simple. After months or years of regular use, the brain adapts to their presence. Suddenly discontinuing them can cause severe anxiety, intense insomnia, tremors, agitation, and in some cases, even life-threatening withdrawal symptoms. Ironically, this makes the medication feel absolutely necessary at the very moment it may be contributing to the greatest cognitive harm. That is why no one should ever stop taking a benzodiazepine without medical supervision. If you have been using one for more than a few weeks, work with your physician to create a gradual tapering plan that may take several weeks or even months. Fortunately, safer options often exist. Medications such as buspirone can help manage anxiety without causing the same level of sedation or cognitive slowing. Cognitive behavioral therapy designed specifically for anxiety and insomnia has also shown impressive long-term results without exposing the brain to the risks associated with chronic benzodiazepine use. The goal is not simply to reduce anxiety today, but to preserve mental clarity for the years ahead. Now we move to number 4, a medication that has been prescribed for decades because it seems capable of treating several different conditions at once: The medication is amitriptyline, commonly sold under the brand name Elavil. Although originally developed as an antidepressant, it is now frequently prescribed in much lower doses for chronic nerve pain, migraine prevention, and sleep difficulties. Its versatility has made it extremely popular among physicians and patients alike. Unfortunately, that same popularity has hidden one of its greatest risks. Amitriptyline is one of the strongest anticholinergic medications still widely prescribed today. Like several other drugs already discussed, it blocks acetylcholine, the essential chemical messenger responsible for communication between neurons and the formation of new memories. But unlike some milder medications, amitriptyline blocks this pathway very powerfully. Over time, the result may be much more than occasional forgetfulness. Long-term use can gradually interfere with the brain's ability to process, store, and retrieve information. Research published in JAMA Internal Medicine in 2015 followed more than 3,400 adults aged 65 and older over a 10-year period. Those with the highest long-term exposure to anticholinergic medications, such as amitriptyline, experienced a 54% greater risk of developing dementia compared with those who had minimal exposure. What makes this finding especially concerning is that most patients never realized the medication could affect memory at all. Many were prescribed it for nerve pain or insomnia, conditions that seemed completely unrelated to brain health. As the years passed, they began searching for words more often, losing concentration during conversations, forgetting familiar details, or struggling to focus on everyday tasks. Because these changes happened slowly, they were almost always blamed on normal aging rather than on the medication itself. Another important point is that these effects are not limited to high doses. Even relatively small doses, taken every night over several years, may gradually increase the anticholinergic burden on the brain. If you or someone you care about has been taking amitriptyline for a long time, it may be worth discussing safer alternatives with your healthcare provider. For chronic nerve pain, medications such as duloxetine or gabapentin may provide effective relief without carrying the same degree of anticholinergic activity. For sleep difficulties, low-dose doxepin or melatonin may be appropriate in certain individuals, and for depression or anxiety, newer antidepressants, including sertraline and escitalopram, are generally considered much more favorable for long-term cognitive health in older adults. None of this means amitriptyline is the wrong medication for every patient. In some cases, it remains the best choice. The important point is that every long-term medication deserves periodic review, especially when memory changes begin appearing over time. As we continue this countdown, the next medication becomes even more surprising because it belongs to a group of antidepressants many people believe are among the safest available, yet one particular member of that family stands apart for all the wrong reasons. As we reach the end of this list, the most important message is not fear, it is awareness. Many medications are prescribed for good reasons and can provide real benefits when used correctly. The danger comes when we stop reviewing them, when years pass without asking whether the same treatment is still the safest choice for our changing bodies and our aging brains. Memory loss is not always something we simply have to accept. Sometimes there are hidden factors that can be identified and addressed. A medication review with your doctor or pharmacist can reveal combinations that may be affecting your focus, energy, or mental clarity. Never stop a prescription suddenly on your own, but never be afraid to ask questions either. Your brain is one of the most valuable parts of who you are. Protecting it means staying informed, having honest conversations with your healthcare team, and paying attention to changes that your body may be trying to communicate. If you or someone you love has noticed increasing forgetfulness, confusion, or unusual brain fog, start by looking at the bigger picture. The answer may not always be aging. Sometimes it begins with understanding what is inside the medicine cabinet. Thank you for watching. Stay informed, stay proactive, and remember, taking care of your health today can help protect the memories you treasure tomorrow.